This is Professor Cruz. This week we're going to talk about the demographic transition, population structure, and the epidemiologic transition. Last week we were able to begin to discuss how the factors of births and deaths have affected the global population throughout history and some of the cultural factors that determine birth and death rates. We answered the question, where is the world's population distributed? First, let's talk about the data that you used to answer this question. We watched some videos, and the data that was collected for you and shared in these videos was collected by national governments in the form of censuses, birth certificates, death certificates, and other registration systems. While countries do not generally take a census each year, agencies estimate country and global population numbers and trends. Such agencies include the United Nations, the World Bank, the U.S. Census Bureau, the Central Intelligence Agency, the Population Reference Bureau, and others. These are primary and secondary data collection and compilation entities that are credible. When you are searching for information on world and country populations, these are entities that you should use. Generally, you should be using entities that have a .org or a .gov on the end of their URL, not a .com. But remember, there are limitations to all data collected, and there are limitations to all methods. The United States takes a census every 10 years and has done so since 1790. Other countries collect information about their population in different ways. We looked at data in tables and maps last week. Now we're going to view population information through other types of graphics. Our questions for consideration this week. Since last week we looked about world population growth, now let's talk about why does population growth vary among regions? Since we know that population growth is the largest in Asia, or the most people live in Asia, let's talk about the variations in regional growth. How do the age and sex structures of a country vary, and why does that matter? We briefly looked at the world population data sheet, and we saw that the number of percent of the population under age 15 and over 65, we're going to talk about why that matters. What health threats do people in different regions face? How have the demographic and epidemiologic transitions affected our life expectancy and likely cause of death? So also on the world population data sheet, we have a life expectancy at birth. What is your life expectancy at birth? So think about that as we continue on this discussion of the demographic transition. Last week we learned that human population grew very slowly at the beginning of time up until about, let's say, the 1500s. Prior to the New Stone Age, humans were hunters and gatherers, moving from one place to another in search of food, and usually not settling in one area for more than a year. Eventually, people began to settle in locations around the world as farmers. As people had more reliable food sources, the population slowly began to grow, and also families needed more people to help farm the land, so they wanted to have more children. This image graphically replicates the information explained last week. From the beginning of time, births and deaths were high, the global population grew slowly because of famine and disease, and as the famine and disease declined, mortality rates declined, and then population growth is at the fastest period of growth in history. The Industrial Revolution, whose origin was England, sped up population growth in Europe. While taking until 1800 to reach 1 billion, each additional billion has been added to the world's population in a shorter and shorter time. While we have been adding the 6th and 7th billions in 12-year increments, the United Nations projects the population to peak at around 10 or 11 billion around 2100. But again, this is a projection. We actually don't know what's going to happen. What we do know is that the growth rate was highest in the 1960s at 2.1% per year. The growth rate has actually declined to 1.2% a year today, yet the size of the world population has continued to increase. And the reason is that there are more people to apply that 1.2%, and also most of the people in the population of the world are very young. This chart shows that almost all of the current and projected growth is slated for less developed countries. Most population growth is concentrated in the world's poorest countries and within the poorest region of these countries. To understand how population has grown so rapidly in such a short period of time and the differences in the rates of growth among different countries, we will now turn to the force called the demographic transition. The demographic transition is a model of population change. So we think about that population change that has occurred in the world, where high birth rates and death rates transition to low birth rates and death rates. It is divided into 4 stages. Remember, when looking at a population without considering migration, a population can only grow if births are higher than deaths. That is why it's called natural increase. Stage 1 is a low growth stage with both birth and death rates at a high level, resulting in very low growth, that growth that occurred throughout most of history. For most of this period, people depended on hunting and gathering for food. When food was easily obtained, a region's population increased, but it declined when people were unable to locate enough animals or vegetation nearby for food. There are currently very few countries, if any, in stage 1 of the demographic transition. Stage 2 is a period of high growth caused by a decline in death rates. So you see on the chart, the death rate goes down, but actually the birth rate stays relatively high. That line on the top, which indicates the birth rate. The more developed countries entered stage 2 during the Industrial Revolution. So during the Industrial Revolution, in developed countries like in Western Europe, in the United States, the death rates declined due to various measures. Many less developed countries entered stage 2 much later as a result of the diffusion of medical technologies and public health interventions introduced and shared by the more developed countries. Stage 3 is characterized by decreasing growth. So death rates have declined, and now birth rates also begin to decline. This results in decreasing growth as death rates continue to decline. One reason that fertility declines slower than mortality is because women or cultures have to have time to react to lower infant mortality rates and lower death rates overall. It takes generations to change culture, and fertility is more of a result of culture change. Once people realize that more of their children survive to adulthood, and also perhaps economies change and people move from a farming economy, families have a need for fewer children. Stage 3 is marked by low in birth rates and death rates, leading to nearly zero natural increase. And when their countries reach zero natural increase or extremely low growth, they are at stage 4. So stage 4 is similar to stage 1. The similarity is that they both have low growth. But the difference is in stage 4, both birth rates and death rates are low, while in stage 1, both birth rates and death rates are high. In stage 4, life expectancy grow and increase, and this is where life expectancies start getting into the 60s and the 70s. Many experts believe that there are no countries in stage 1 of the demographic transition. However, demographers from the Population Reference Bureau suggests that Afghanistan, Uganda, and Zambia, and other countries that may be at war are still in stage 1 because their death rates continue to fluctuate. It's also more likely that there are regions within countries that may be at stage 1. You can look at your population data sheet to check the birth and the death rates. These nations all have total fertility levels at 5 or higher children per woman in her lifetime. Ghana, Guatemala, and Iraq have lower birth rates than the first 3 nations. Even so, their birth rates are significantly higher than their death rates. Their populations are expected to continue to grow for several decades. India, Gabon, and Malaysia are areas where in phase 3 of the demographic transition, getting closer to replacement level fertility, which is indicated at 2.1 children per woman. But their birth rates are declining, but they still are growing. And then finally, we look at the countries in phase 4, which are low to very low birth rates and very low death rates. We see Brazil, Germany, and Japan are all countries with low birth rates and low death rates, and growth is very low. If you review the birth and death rates for these nations on the World Population Data Sheet, you will see that for Germany and Japan, the death rate is actually higher than the birth rate. So the total fertility rates are also below 2.1, which is replacement level fertility. Germany and Japan are currently at negative growth through natural increase. Some sources indicate that these countries have passed through all the stages of the demographic transition and may currently be at stage 5, which is called decline. Where birth rates in developed countries decline slowly over 200 years, so remember those videos that we watched, birth rates in developing countries have declined more rapidly over the past 50 or 60 years. One challenge to slowing birth is the cultural history of early marriage and limited education for girls. One way that countries can lower the birth rates is to increase education for girls or increase the number of girls who go to secondary school, and also increase the age at marriage. This graph shows the declining numbers of young women married and early in selected countries: Niger, Bangladesh, Ethiopia, Egypt, and Peru. It shows the the age at marriage in a earlier year, so for Niger, 1992, and then for 2012. The darker blue portion of each bar shows the percent of young women married by age 15, and then the lighter blue portion shows the percent married by age 18. For all countries except Ethiopia, the percentage has dropped significantly. While most women in Niger and Bangladesh still marry early, fewer are marrying by age 15. So now in Niger, 28% are married by age 28% are married by age 15 in 2012, even though 76% are still married by age 18. In a country like Peru, you see that the age at marriage for 15-year-olds is much lower at 3%, and those marrying by age 18 is 19%. And if you look at the total fertility rates, you should see some correlation. Early marriage reduces the opportunities for adolescent girls and leaves them vulnerable to early pregnancy and childbearing, and prematurely ends their schooling. Part of the overall decline reflects improvements in girls' access to education. As girls' educational attainment improves, the proportion marrying early tends to fall. The total fertility rates correspond. The total fertility rate in Niger, which has a high level of women married by age 18, is 7.6 children per woman. It's 4.1 in Ethiopia and 2.5 in Peru. Another method to reduce births is to increase access to modern methods of contraception. This indicator measures the proportion of women who want to delay or limit childbearing and who are using modern methods of contraception. And you can see what those methods are by looking at your world population data sheet. Over the past 2 decades, a significant number of less developed countries have seen increases in the share of demand satisfied with modern methods. Again, when you compare the high rates of modern contraceptive use, those also correlate with total fertility. The percent of family planning demand met by modern contraceptive methods for Nigeria is shown from 1990 to 2014, with the green line usage increased from 13 to 31%. So look at that green line, Nigeria, the dark green line, 13 to 31%, and the total fertility rate is 5.5. The increase in Pakistan is greater. Pakistan is shown in the light green line, growing from 21 to 47% in the same period. The corresponding total fertility rate is 3.8. And in the Philippines, use grew from 40 to 71%, and that is shown with the orange line, and the total fertility rate is 3.9. But it was a decline from 6.0, the total fertility rate of 6.0 in the late 1980s. In 1949, China's ruler encouraged population growth, and then the population doubled, food supply slowed, and a famine killed 15 to 30 million people between 1959 and 1961. So China introduced what was called a one-child policy in 1979. Since 2000, China has a lower birth rate than the United States. So the core of the Chinese government's family planning program was the one-child policy. Couples in China received financial subsidies, long maternity leave, better housing, and in rural areas more land if they agreed to have just one child. Now, you will read about the one-child policy and see that it was very coercive for some people. However, it did have the desired effect of lowering birth rates in China. The government also prohibited marriage for men until they were 22 and women until they were 20. As we've gotten to the 21st century, the rules have changed, and as China has moved to a market-based economy, families are becoming wealthier. In 2015, China relaxed the one-child policy, allowing couples to have a second baby if the mother or father was an only child themselves, and at this point, the policy has actually ended. While it is in the early days of the new policy, many parents are declining to apply for a second baby due to fears of financial burden, family opposition, and a change in the generation that have grown up as only children. So the cultural change was now affected by the one-child policy. In the short term, since the policy has been relaxed, people aren't wanting to have more children because, one, they see that it's very expensive and the economy is different. We'll see what happens as we move forward. So let's now move on to discuss how changes in birth rates, death rates, and fertility have an impact on a nation's age and sex structure, and what this means for future growth, the workforce, and the ability to care for the changing population. This graph shows the age and sex structure for the United States in the year 2012. This type of graph is fondly called a population pyramid, and we'll learn why this is the name in a little while. This is a histogram, so it's a type of graph that shows the age and sex distribution of an area's population. We have males on the left, in this case in the color blue, and females on the right. The bottom bar shows the percent of the population aged 0 to 4, and as you move vertically up the graph, each bar shows the next age group until you reach the population at age 100 on the top of the graph. Now, some of the graphs have slight variations on how high the ages go, but this is generally a standard version of a population pyramid. It shows the population at one point in time, in 2012, when President Obama and Dr. Cruz were both 50 years old. And so one of the things I would like to ask is, which age group were you in during this time period? For the United States, this shows a population that is aging. You see the bulge of the baby boom generation. Here they are represented in the bars from ages 45 to 70. And the children of the baby boom generation, which is called the baby boom echo, represented in groups ages 15 to 34. So you can think about this as a snapshot in time. It doesn't necessarily tell you how things got to be that way. It shows you the population by age at this point in time. Now let's move on to look at the age distributions for some other countries. We talked about Uganda being possibly in stage 1 of the demographic transition. Stage 1 is represented by high birth rates and declining death rates. So let's look and see what the age structure of a country in phase 1 might look like. So this is Uganda. On the left, we'll look at Uganda in 2010, and in the right, it's the projection for 2050. Now we see why these graphs are called population pyramids. Here, the males are shown in black on the left side, and the females are shown in blue on the right. In a high birth rate country, there are more children than people in the other ages. So in Uganda, you have almost 50% of the population technically still below the childbearing ages, between 0 to 4, 5 to 9, 10 to 14. Almost 50% of the population is referenced here. So what we know about this population, even if the birth rate were to decline, the population would still grow because the population has not reached the childbearing ages yet. In Uganda, each woman averaged 6 to 7 children, and deaths to children under age 5 are decreasing due to high levels of immunization, better maternal care, and better use of health services for ill children. However, fluctuation in death rates are caused by poor nutrition, a high maternal death ratio, and high levels of HIV and AIDS. So this is why the Population Reference Bureau places this group in phase 1. You can check these numbers on your World Population Data Sheet. There are very few people over age 65, only 2%, and there are more males than females in adult ages, indicating a lower status of women. Generally, women live longer than men. In the U.S., women live 5 years longer than men on average, but in Uganda, the life expectancy rate is just 2 years more for women. The population will continue to grow as this group moves through their childbearing ages. So even if fertility is cut in half, this group would still average 3 children per woman. This means that the population will continue to grow for several generations. And you see in 2050, the population pyramid still looks like a pyramid, but it's starting to look more like a pillar, which shows a decline in the total fertility rate. Now let's go to a country that is possibly in stage 2 of the demographic transition, and we're going to look at Guatemala. So remember, phase 2 is the birth rates are high, the death rates are falling and declining. So Guatemala's population structure illustrates that women have been having fewer children for several years. You see there's still a large percent of the population, 10 to 14, 5 to 9, and 0 to 4, but the population is filling out in the middle. So it's becoming more elongated. The base of the population is shorter, and there are more people in the Middle Ages. Half of its population, however, is 19 or younger. It's still relatively young, the youngest in Latin America. Guatemala is one of the many countries in the second phase of the demographic transition. When a country's age structure is even from top to the bottom, the country is close to zero growth. So you can see here that Guatemala's population is likely to grow for several generations because it's not even from top to bottom. It becomes more even as we move to 2050, but in 2050, it's still not even. So now we're going to examine the age and sex structure of Germany, a country in stage 4 or possibly stage 5 in the demographic transition. Germany's population represents the shape of a pillar. In 2015, its birth rate is 8, its death rate is 11. So the country, the birth rate is 8 and the death rate is 11, so the country is in negative growth. 13% of the population is under age 15, and 21% is 65 and older. You can see the largest age groups in Germany's population were 40 to 49 in 2009. In Germany, the government offers financial incentives to families for having children, unlike China, but this has not served to increase the birth rate. The age-sex structure is typical of European countries in the fourth phase of the demographic transition who are at equilibrium. Many of these countries have to bring in workers from other countries to supplement the working age population. And because we talked about China's one-child policy, I'd like you for you to look at the effect of the one-child policy on China's age and sex structure. One of the obvious changes you can see is the drop in the percentage of population below age 14. In 2010, 17% of the population was under age 15, down from 23% in 2000. The share age 65 and over rose from 7% in 2000 to 9% in 2010. But you see that the bulk of the population is in the working age group. Imagine the shape in 20 years as the population continues to age. Also note the dominance of males to females in the youngest age group, as the one-child policy changed the sex ratio of boys to girls. Normally, there are about 105 boys born for every 100 girls born in a nation. In China, the ratio of boys to girls is about 120 to 100. So one of the results of the one-child policy is now that the men are of childbearing age, there is a scarcity of women for them to marry. And here I would like you to consider a population pyramid for a county in a state in the United States. Think about what could be the result or what could cause the shape of this pyramid, which is showing such a great number of males aged 15 to 49 at much higher percentages than women. Well, this population pyramid is for the county in which the Western Illinois Correctional Center is located. The Correctional Center has a daily population of 2,066. The all-male population and racial makeup of the prison is so large compared to the rest of the county that it shows like this in the census demographic data. This is evidenced by the lopsided pyramid. So now when you think about it, the men are in the prison, they're counted where they live, and because of the so many males in the prison, it makes the pyramid look lopsided. Sometimes this happens with age in a college town where you'll see a number of young people age, 18 to 25 because they represent the college population. We're going to end this segment on population with a discussion of the epidemiologic transition, which roughly follows the demographic transition, but instead changes in birth rates. It tracks changes in the leading causes of death. The term epidemiologic comes from epidemiology, which is a branch of medical science concerned with the incidence, distribution, and control of diseases that are prevalent among a population at a specific time. Stage 1 is related to the low growth period of the demographic transition. As this stage, mortality is high and infections and parasitic diseases were the principal causes of death. Life expectancy was low, probably 20 to 40 years. Accidents and attacks by humans and animals were also prevalent. History's most famous and violent stage 1 epidemic was the Black Plague, or the bubonic plague, which you saw on that population video, which was probably transmitted to humans by fleas from migrating infected rats. HIV and Ebola are examples of infectious diseases. Malaria is an example of a parasitic disease. Stage 2 is a period where death rates decline rapidly. During this phase, the deaths from pandemic diseases decline. A pandemic is a disease that occurs over a wide geographic area and affects a very high proportion of the population. Improved sanitation, nutrition, and medicine during the Industrial Revolution reduced the spread of infectious diseases. Even with improving conditions, the decline was not as universal, as poor people who lived in crowded and less sanitary conditions are still more susceptible to disease. Life expectancy at birth increases to about 30 to 50 years. Famous pandemics in this phase of the demographic transition include one of the second instances of the Black Plague, the Spanish flu of 1918, HIV/AIDS today, and cholera, which has experienced many instances. The World Health Organization estimates that many as 120,000 people die each year from cholera. Stage 3 is represented by degenerative and man-made diseases where the crude death rate stabilizes. It is characterized by a decrease in deaths from infectious diseases and an increase in chronic disorders associated with aging. These include heart attacks and various forms of cancer. Life expectancy during this phase exceeds 50 years at birth. Stage 4 is delayed degenerative diseases and emerging infections. The causes of deaths are the same as in stage 3, but life expectancy is extended through medical advances. So people may get diseases, but medical advances enable the diseases to be treated so people live longer. Medical operations and healthier lifestyles increase people's life expectancies to over 60 to 70 years at birth. Let's end this section by looking at the causes of death then and now. Look at the causes of death in 1900 compared to 2010. First of all, the number of deaths per 100,000 population is significantly lower. It's almost half. And this is why we have the increasing life expectancy. Life expectancy is probably 30 to 40 years higher. But the 3 top causes of death, so if you start from the bottom of the chart, the pneumonia or influenza, tuberculosis, and gastrointestinal infections were the top 3 causes of death. You also see diphtheria on this list. You've probably never even heard of that disease. Today, most people die from heart disease, cancer, and non-infectious airways diseases, but the top 2 are heart disease and cancer. So what is your life expectancy compared to your ancestors of the late 1800s or the early 1900s? How is your likely cause of death compared to theirs? In 2010, District of Columbia residents 28% died from heart disease and 22% from cancer. So the causes of death today are very different from the causes of death prior to this century. And as we move forward, I want you to think about how that affects your life, how that affects our cultural landscape, and how did the diffusion of public health advances, improvements in nutrition, theories of germ theory, and medical advances changed the cultural landscape of the United States and the world.